You gotta laugh about it, man. When you're in a situation like this, at an event like this, you gotta be funny about it, right?
Yeah.
I actually found there's a comedian that you can find online with epilepsy who jokes about, and that's like his stand-up routine, and it's good to laugh about it. You know what I mean? Makes your problems seem like they're less of problems, you know? It makes you be able to take control of your problems a little bit and feel like you have the power in a weird way, right? I'm here because I have a implant in my head from having brain surgery, from having epilepsy. I have the RNS implant. It is the responsive neurostimulation device, and it's from NeuroPace. And they implant a thing kind of similar to a pacemaker into your head. They actually take out a piece of your skull to stick it into your head, and stick a metal tray there, stick the RNS device in that. Then they run electrodes into your brain, and those electrodes go exactly where your seizures are starting from, where the focal point of your seizures start from. It slowly becomes better at functioning over time from being increased. How do I explain this? So it's got two benefits. So there's the VNS, which is the vagus nerve stimulator or stimulation device that they have here, and that one is just sending electrical impulses to your entire brain at a repetitive rate, however long that repetitive rate is. You know, every X many minutes it will send out this small jolt of energy. Mine, actually, because those electrodes go exactly to the focal point of my seizures, it senses that data and it records that data, kind of like you would get if you were having an EEG study inside of a doctor's office. So it will see all that data, and then at the end of the day I actually hold a thing up to my head and download all of the data off of my head and onto this laptop from NeuroPace, and then send that data over to my doctor. And I see my doctor once every 3 months, and that doctor makes tiny little adjustments to it in the amount of electrical stimulation that it's putting out when it does respond to something. So over time, since it's recording all of those things, when your doctor makes these adjustments, the idea is hopefully those kinds, that data is going to come together, and eventually it's going to be able to sense this activity and respond with this simulation or this stimulation, and then stop that from progressing into a bigger seizure. And it might actually happen before you feel anything, because I mean, it's recording a lot more data than the stuff that I feel in terms of what it sees as abnormal activity. This was like the scariest decision I ever had to make, for sure. I had the surgery 2 years ago now. Seems like it was like yesterday. But time just like gets quicker and quicker the older you get, you know. But it was already 2 years ago, November, when I was 25 years old. Okay. 6 years ago. Actually, oddly enough, yesterday was the 6-year anniversary of my very, very first seizure. I remember putting my shoes on, and that's the last thing I remember before waking up in the hospital. Definitely a weird experience. And also seeking more and more opinions from other neurologists. It took me a long time to find a neurologist I felt like actually cared, you know? And I mean, the first drug I ever got put on was Keppra, and obviously everyone gets affected by side effects, or you know, gets the side effects from drugs differently. But if you Google Keppra rage, that comes up as like the #1 side effect. And the fact that that drug has a nickname for a side effect with the word rage in it is kind of scary. And that perfectly describes how Keppra made me feel. It turned me into like a just raging monster. And I was like pleading with that neurologist to take me off of that medication, and he was the snarkiest, just meanest guy. At one point, he's like, well, if you just want to try something else, tell me what you want to try. Here you go. And he handed me his prescription pad or whatever, just in a jokingly handing it, just trying to be like, screw you, man, whatever. Like, this is the best thing for you, so you think something's better, try that. And that's when I had to go seek out another neurologist. And I think we're at 5 or 6 neurologists later, and now I'm finally at the one that I have now that I've been with for the past couple years, or past almost 3 years probably now. So it took me a few years to find her, but once I found her, I actually started getting answers from a doctor I felt like actually was looking out for me, you know. After trying a few different medications, I was told basically in most people's cases, people like me are defined as medication resistant with epilepsy. And that means that if you've tried more than several different medications, there is a very high likelihood that no medication will work for you. And if it does work for you, it probably won't work for you forever. You'll have a honeymoon effect is what my doctors have liked to call it. And they tried several medications, nothing was working for me. I was still having tons of seizures. If anything, my activity was increasing. And you know, that's when I just went and had more and more and more and more testing done. And they tested me for being a candidate, you know, so I had to get the stereo EEG and all that stuff done before this. You know, so far, it's something you have to be so patient with, you know. And they say that the RNS can take years and years for it to really become more efficient at what it's doing. And you hear from people that have had it for 4 or 5 years, and they are the ones that are saying more so like, this thing definitely changed everything for me. For the first year that I had it, it wasn't doing a whole lot. I was having a lot of seizures still, and that was really depressing. I just had a hole cut out of my skull and had this thing stuck in there, and it didn't fix anything, you know? I was still stuck. So then after I had a really bad seizure about a year ago, I started taking Onfi and added that to the other 2 medications I take, and that is when my seizures were controlled more. And from the data that I've seen from my doctor, the RNS definitely still is recording data. It is still responding to certain events, but there's no doubt that the pharmaceuticals are also playing a role in controlling it. I see things so much differently. It's hard to even remember how it felt before this, you know? Like, it is such a strange thing because it is such a widespread epidemic, and it is something that is so infrequently spoken about in a very large quantity of people or very publicly. And I mean, I really didn't think when someone told me they had epilepsy or they had seizures, I didn't really even think twice about it a lot of times, you know? And then once it happens, you're like, wow, this is such an insane thing. And then once you're part of that community, you realize how many other people are affected by that. And it changed my entire life. It changed how I look at life. It changed how I live my life. It changed everything, you know? Some for better, some for worse, obviously. It's taken away all of my personal freedom for the most part for quite a while. But hopefully that's something I can regain eventually. I will definitely speak very highly with the fact that UCI has done a great job overall with all of my inpatient studies that I've done. When I had my inpatient EEG and my SEEG and my RNS surgery, all of that, they've been really good. The entire staff, the nurses have been there to make you feel comfortable, everything, and the surgeon was great. Dr. Videra did a wonderful job. And probably a combination of the fact that he did such a great job and I'm such a stubborn person, I really did not want to take the pain medication for very long because I am one of those people who is fighting and looking forward to the evolution of things like CBD in this world of treating epilepsy, because I don't want to be stuck on pharmaceuticals for the rest of my life, you know? Like, I know that these things have negative effects on your liver and your teeth and, you know, other organs and just everything, you know, and it just affects you in such an unpleasant way when you compare it to this plant that has so many more things going for it in terms of what it can do. And I've been able to kind of witness that because I actually worked in some cannabis dispensaries years and years ago before this ever happened, before it was recreational in California, when it was only a medicinal thing. And I've seen people use different forms of cannabis to treat different illnesses, and there's not enough information out there yet, but there needs to be, you know. CBD is something that I have a love-hate relationship for it, because there's a million people trying to capitalize on the popularity and make what they can off it right now, and then there's a million other people trying to fight and advocate for it to become a more widely known and accepted and understood medicine, you know. And while those people kind of come together at some point, because you got the people that want to make money and the people that want to help everyone, and they eventually will all be going towards making more information for CBD available. Obviously, it's the people who are fighting for its knowledge and all that stuff that I really just am hoping that that makes it out there. Like, I would love if I could go get a prescription that was covered by my insurance for a CBD brand other than just the one choice that I have out there right now, which is Epidiolex, which, I mean, the reality is we don't know a ton about them yet, you know. I want more choices, that's for sure, and CBD is something I want more choices with.
So I met his father when I was 15. Sorry, do you not want me to talk about this? Because I won't if you don't want me to. I met him when I was about 15. Yeah, I was 15. I was ditching school, working in a pet store. His dad was a lot older than me. These days, they would put him in jail, but unfortunately, my parents were a little bit, I think they got married and had kids because that was the thing to do. I mean, they wanted to, but I don't think they really understood the scope of what that means. So they told me, well, she seems to know what she wants, so go ahead. And, you know, 15-year-olds don't know what they want. I had a man come to me and tell me, oh, let's get a pet store together. This will be great, you know? No, it's not great. It's trouble. And so I wound up having Kyle, and he was very persistent when I got pregnant that we were going to have a baby and this was great and he'd be there forever, and he wasn't there forever. He was there for about a year and a half, maybe less. And that was it. I was on my own. So complicated. Very complicated.
Did you have Kyle? Because so far your story sounds like you had him at 15.
Oh, I got pregnant. I was just barely 17 when I got pregnant. Yeah. Too young to be having kids for anyone. And I know people come up to me and say that in other countries they get married at 13 and babies are born at 15 and blah, blah, blah. I'm sorry, you're not ready emotionally, mentally, anything, especially maybe back in the Middle Ages where all you had to think about was gathering food and things like that. But now with the scope of the things that are, the information that bombards you, you're just, yeah, you might as well be a baby at that point, in my opinion. As horrible as this sounds, I thought that he drank too much the night before, because he called me, and he sounded fine when he called me, and we were going to get together with my brother and his family who came from out of town. We were going to Disneyland. He called me and said, can I get you a cup of coffee? And I'll meet you at the house. And I got there, and as I'm pulling up, I saw my brother across the street in the neighbor's yard. And this is a really nice neighborhood. So, you know, with the big houses and the manicured, and I'm like, what is he doing over there? And I looked and I saw my son Kyle laying in the grass. And I thought, what happened to him? You know, his stuff was strewn all over, and I went running over there, and he was completely disoriented. He had a big knot on his head, and he had blood on the other side, and I was like, what in the world happened to him? At first I was really angry, because I thought, oh my God, he went out and partied it up last night, and, you know, but then I thought, I talked to him. He didn't sound like he was hungover or anything like that, so we didn't know what happened. We called an ambulance because he was completely knocked out when we first found him, and then so disoriented that he looked at me like he didn't even know who I was, which was terrifying. So we went to the hospital, and they did all these tests, and they said, we don't know what happened to him. But I thought, well, maybe he got hit by a car, but that didn't really pan out either, because he had no defensive marks. Like, if you got hit by a car, you'd have skinned knees or you'd have something. The only injuries he had were to the top of his head. He had a huge abrasion on this side that was bleeding, and a big giant goose egg on that side. So I have no idea how he could even fall that way. So we had no idea at all what happened. It was 8 months later. 8 months went by and everything was fine. We actually went for separate testing after that incident. I took him to a lady neurologist, so I won't mention her name because she was pretty unkind to us, but she did some testing for him. I paid for that out of pocket because I was scared something was wrong with him, and all the stuff came back normal. So we went on with our lives. 8 months later, he was staying with my parents, and I was on a vacation with my husband, and he threw himself out of a platform bed, and my mom actually witnessed him having a seizure, so she called an ambulance, and he went to the hospital. Yeah, it was about, I think it was 5 months after that was the third one, and that was the first one I actually saw, which was a shock. A really big shock. Am I allowed to tell them? So we have an upside down house. We have our bedroom and our bathroom are downstairs, and we have one shower that we share, and he was staying with us, and I was in bed sleeping, and I heard him scream, and I went running in there. Thank goodness the door was open, but I went running in there, and he was on his back in the bottom of the shower having a seizure. And I did not know what to do because that's the first time I'd ever seen anything like that before. So I had on a big fluffy robe, and I pushed him up, and I squeezed myself behind him. I turned off the water, covered him as well as I could, and squeezed myself behind him to hold him up because he was salivating so much I thought he was going to drown in the shower. And when the seizure stopped, he was leaning against me, and I said, are you okay? What can I do? And he just kind of said, uh-huh, and nodded, but I had no idea what postictal was at that time. It's a state where you're on autopilot, and you basically are moving around, but you're not in there to really know what's happening. It's very dangerous, because you could walk out into traffic and not even realize you're in danger. So he got up out of the shower, and I'm trying to hold the towel because he's disoriented and his back's bruised, and he went straight up the stairs and tried to walk out the front door. And so I dropped the towel, and I'm holding the door shut, and I'm screaming at him, no, you can't do this. But he didn't even seem to realize I was there. He was completely, I felt like I was invisible, and I'm thinking the neighbors are going to call the police, thinking I'm being attacked or something, because I was screaming at him and he couldn't hear me. And we struggled with the door for over half an hour while he was trying to get outside. And I finally got him turned around, and eventually he went into his bedroom, pulled the covers down, and got into bed. And I was like, okay, I'm just going to let this be because I don't know what's happening here. And when he woke up, he saw me sitting there anxiously and just looked at me and went, what are you doing in here? And I said, this crazy thing happened. You're not going to believe this. And he's like, no. And I said, well, you're wet and you're naked in bed. So, and he looked and he's like, yes, I am. So we figured, okay, so there is this weird after period where, you really have to be careful because that person just might get up and walk out the door without any clothes on. That was terrifying. And after that, they got closer and closer together until he was having 30 to 40 a month. That lady she actually tested him in the waiting room, made him come all the way down there and made him sit in the waiting room for a long time. And he kept saying, well, I just need this paper signed by her. Can you just go have it? Can you, he's asking the receptionist, can you have her sign it? And they kept sending it back. And then when she finally came out, she said to him, oh, I was just trying to see what would happen. Just trying to see if he'd have a seizure in her waiting room, I guess. I don't know. But I was like, that is so unprofessional. So that's the end of that. We're not going back to her. I think it was the next one that threw the prescription pad at him saying, well, if you don't like my prescription, you can get your own. Okay, well, we don't need somebody who isn't there to help us understand what other kinds of medicines are out there. And I think the one after that, I had questions for him, and he was in a hurry. So he said, well, I'll be back in a minute. And we sat in the waiting room, the examination room for probably another half an hour, and I went out and asked him, you know, is he going to come back? Because I had some questions, and she said, oh, he already left for the day. I'm like, oh, good, good. We don't need that one either. He obviously does not care about us. So let's move along. And the next one was a woman. She is the one that actually put us on the right path. She said, I don't know what to do for you. This is out of my scope. I'm a neurologist, but you really need to see a specialist because this isn't working for you and you need more help than I can give you. So she mentioned the program at UCI, and we looked into it, but our insurance didn't cover that program. So she advocated for us, and she got our insurance to pay for the program so we could go to UCI. There we found the doctor that actually said, you know what, we have all these options. Let's do some testing and find out what we can actually do for you. So that's how we wound up with Dr. Manatsakanyan and the surgeon, Dr. Vadera. They're both really wonderful, caring people that go the extra mile for their patients, for sure.
Izzy and I have been together over 10 years. We met each other at Anime EXPO. We're anime nerds.
No way.
She lets me keep my manga collection. I have a huge wall. Love it. But the thing was, so after convincing her after many years, we finally got married. And 6 months after we got married, Kyle developed epilepsy. So at that time, Kyle was on his own. He was independent. He had his car, had his job, had his dreams, had everything that he wanted to go forward in life with. He was doing his own thing. And then literally overnight, everything changed. He couldn't go to the job that he enjoyed. He couldn't do the tasks that he enjoyed. He lost his driver's license. He was put basically on hold to reevaluate how he wanted to get through life. And shortly thereafter, Izzy mentioned that, you know, there was a second seizure. When that happened, there was discussion, and I said, you know, he's family. He should just move in with us. He needs obviously more help than he can get elsewhere. Let's bring him in so that he has someone there. We knew of some of the dangers of epilepsy, but we didn't really know all of them. And I told my wife at this time now, 6 months, it's family. You just do whatever you need to do for family. You kind of just make sure that everybody functions as a unit. That's what family's for, is to make sure that everyone helps anyone else that needs help. So we gave him a place. She, at the time, recently got off her previous job. I told her, I really want you to work at home anyhow. You're already preparing for that on some levels. Just take care of Kyle too. Just stay home, do what you can do. So she basically had to, in some ways, become his caregiver. At first, we kind of tried to function how we could. Kyle tried to pursue some of his hopes, his dreams at the house. But as the seizures kept increasing in frequency, there were certain dangers that we said, you can't be in these situations. We need to make sure that we maintain your safety first while we reevaluate and figure out how we can do everything in the future. And at this point, I'm still going to work every day. I would occasionally get calls. He had a grand mal. Do you need me to come home? No, we timed it. It's fine. The time period's fine. He's below 5 minutes. It's fine. Luckily, somehow, most of the bigger ones, I've been there. This comes down to the fact that I'm closer in mass to Kyle, so if there's an issue and we need to take him to the ground on his side, and by the way, learn epilepsy first aid. I don't care if you have family members, learn it. It's good to know. I'll go into a story later. But, she can get him on his side if he's in the house, but if we're like out and about in the car, it's a little bit harder with the size differences. So luckily, for a lot of the worser ones, I've been there and I was able to assist. But it's just one of those things for me where my mind works differently, I think, than most. I take in a situation as, I can't control the situation. I have to accept the situation. Let's keep the situation moving, do what's best, do what's safe for everybody, and I emotionally evaluate it later. My wife is a little bit different. She's very emotional from the moment it happens. It's her baby, something's happening, and we start communicating. We say, somebody start the timer. Somebody, get him on his side. Are you checking his breathing? We're doing all these things as a partnership, when we're both together. But when we're alone, she has to do it herself. She has to remember her playlist. You know, start the timer. We need to make sure it never goes over 5 minutes. We need to make sure he's on his side, make sure he's breathing, watch his lip color. So she's always been the, you know, calls me after the fact. You know, it's happened. It's good. I'm recovering, but you know, it scared me. It scares her every time. There's never a time where it's not scary. The story I was going to say was I met somebody else with epilepsy, ironically, at another walk for another neurological disease, and she had a seizure in front of me, and I helped her based on the fact of I helped Kyle, so I'm used to some of the symptoms, and I saw it, and I grabbed her, and I said, you need to go to the ground, and she just started nodding. She couldn't speak anymore. She's still trying to walk in place, and I helped her down. And it's those things you don't know and don't realize until people tell you. It's good to just know the basic things, you know, get them on their side, make sure they're breathing. Just wait till it's end. You know, if time exceeds, have someone call 911. If you're the one on the side, have somebody else do it. You know, see if you can get other support. And that's, you know, we're all a community. We're all humans. We have to help each other if we see it. One of the things that Kyle became more cognizant about was with epilepsy is that how it's portrayed online and through various videos, and how we witness some people saying, oh, he's just drunk. He just drank too much. I mean, Holly, before she knew what epilepsy was, thought that happened. Izzy, before, pause, God. Izzy, before Kyle developed epilepsy, you know, her initial response was, maybe he partied too hard the night before. You know, it was then when she reevaluated, no, this is not related. And too many people on the street may have those types of issues, and people don't know what to do or don't know what it is, so they just classify it what in their mind's easiest, what they know. There's a lot of out there, and especially in epilepsy, it's a spectrum. Some people have clonic, some people have clonic tonic. They're different things, and you have to accept the fact that it can appear many different ways. Excuse me. So for me, it's been an interesting experience in the sense of it's a family member. I got a live-in, stepson 6 months after I got married, which was an interesting experience. It wasn't what we thought would happen. And for the most part, I'm very happy that there appears to be progress being made, both on a technical level and in terms of the frequency of seizures that he's had. And I think there is hope out there. And I think that as things continue to change and continue to evolve, and one of the doctors put it best, in a lot of ways, we're still in the Stone Age. We're only going to keep discovering more and better things. And as those things become available, we can only come closer to what actually is the truth on epilepsy, which we're still discovering to this day.